Honorable Vice President of the Republic of Zimbabwe, Comrade Kembu Mohadi, the Minister of State, Matabeleland North Province, Honorable Richard Moyo. There's quite a few of us Moyos. Honorable Ministers of Health from other member states and heads of delegations from other member states, the Director General, ECSA, Secretariat, Professor Dambiswa, all senior government officials who are here present. Ladies and gentlemen, I want to just indicate that last week I was in Namibia, in Windhoek, Namibia, where as SADC health ministers we gathered together, and we also had a side conference on the elimination of malaria, of which I chair. I saw Dr. Shiva was there, and I see him, he's here again. He is definitely a public health specialist with a keen interest on Southern Africa. And he was also in Astana, yes, we saw him there. Like the Director General said, Astana, we celebrated the 40th anniversary of Alma Ata. Everybody was so used to Alma Ata. Alma Ata being where the first declaration on primary health care was made, in Kazakhstan as well. Astana is the new capital of Kazakhstan. So we learned a lot in Kazakhstan, in Astana, and that declaration transforms what was initially declared at Alma Ata, in that it now brings in the integrated approach. 40 years ago, IT was either non-existent or very poor. And now we want to utilize IT systems, take advantage of telemedicine at that low level. We can't stay behind and say that what was said 40 years is still relevant. We have to say, okay, it's relevant, but we must improve on it. That's the key issue. Improvement on what was set as the backbone of primary health care. So here in Zimbabwe, primary health care remains the main backbone of our healthcare system. And we're going to be working flat out to ensure that we improve and emphasize more on the integrated approach, starting right at the village level with health posts at the village level. The rural health clinics, where you can be able to do some simple tests, point of care testing, laboratory testing for malaria, blood sugars, hypertension, a small bathing suite, and so on and so forth. Even a simple mobile X-ray at that level, linked with telemedicine for the report to come from a central position, central hospital, from a specialist, send back the results, and the worker at that rural health care center will be able to take action, appropriate action. And the system of referral becomes much, much easier, rather than the current situation where we find people coming directly from the village straight to a quaternary center. We want to avoid that. We want the village post to feed into the rural health center into the district hospital, into the provincial hospital, into the quaternary center or the tertiary healthcare center. That's the way to go. I was making a comment that ECSA has done very well for us in as far as manpower development is concerned. It's one of the major aspects which I always say, ECSA, ECSA, ECSA. You know, before we used to send all our candidates for specialist training out of Zimbabwe at a major cost. And it's the same for all the countries, you know, in East Central and Southern Africa. We send them abroad far at a major, a huge cost. Now they can train within our own countries, you know, getting tuition from our local specialists. And we save a lot of money, save a lot of foreign currency, which we don't have anyway. They get their tuition, they get their practical knowledge, their practical skills are enhanced under the tutelage of specialists within country. So it makes a lot of sense, and then they're examined by the ECSA College of Health Sciences. I'm an my educationist myself, and that's what I've been promoting ever since I came in. We want to see improvement of skills. We must make sure that, you know, we have adequate skills so that we can be able to look after ourselves in a much, much more organized manner. So at those rural health care centers, we also want to see qualified people providing a service. And this means that we'll be able to create more employment at that level in countrywide. So, it is therefore my pleasure, Honorable Vice President, to welcome you to this 67th ECSA Conference of Health Ministers, being held here in this lovely tourism town of Victoria Falls. Zambia are also here, and we are very happy. We all compete for Victoria Falls. And I know South Africa, they literally say that they own Victoria Falls. We don't mind as long as the money comes our way. So, Honorable Vice President, this meeting is a regional intergovernmental health organization that was formed, like the Director General said, in 1974 to foster and promote regional cooperation in health amongst member states, and aims to raise the standard of health for the people of the region by promoting efficiency and effectiveness of health services through cooperation, collaboration, research, capacity building, policy development, and advocacy. And to achieve this, ECSA functions under the direct control of the member states. The Conference of Health Ministers is therefore the highest governing body of the ECSA. It meets annually to review policy matters, national health strategies, and to define regional health priorities. And to make the Conference of Health Ministers more effective, a deliberate decision was taken to monitor the implementation of resolutions made at such gatherings. There is now a standing agenda item on the ministerial statements, and in these statements, the ministers of health state the progress their countries would have made on resolutions of the previous conferences. And this year's theme is universal health coverage, addressing the health needs of the undeserved. And this theme resonates well with the thrust of the Zimbabwean government, as Zimbabwe has made good strides in this and is committed to achieving this goal. I had my counterpart from Uganda, Minister, you were saying that you were used to Dr. David Parrenyatwa, who was here as Minister of Health for a very long time, and that you chose and decided to make him the Dean of Ministers. Is that correct? So now I come in, I'm still new, I've just been recently appointed. Please don't make me the Dean of Ministers. You can make me one of your students.